Hello and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for April 16th, 2025. Thank you for joining us today, and thank you to the current Osteoarthritis Action Alliance sponsors shown here who help support our work, which includes the monthly Lunch and Learn series. I'm pleased to introduce our speaker, Gregory J. Welk. Dr. Welk is the Barbara E. Forker Professor in the Department of Kinesiology and a Distinguished Professor of Human Sciences at Iowa State University. His research interests focus on the assessment and promotion of physical activity in different populations and settings. A unifying theme in his work is the translation of research into practice. He currently coordinates the campus-wide Translational Research Network at ISU and leads several translational projects through this group. He has been leading the statewide dissemination of the Arthritis Foundation's evidence-based Walk with Ease intervention in collaboration with the Iowa Community Hub. He is the PI for a CDC-funded cooperative agreement focused on fall prevention, as well as the CDC-funded cooperative agreement focused on facilitating the dissemination of falls prevention and evidence-based arthritis programs across the state. The title of today's presentation is Community Partnerships to Enhance the Reach and Effectiveness of the Arthritis Foundation's Walk with Ease. Welcome, Dr. Welk. Take it from here.
All right. Yeah, thank you very much, Serena. So I've been working and collaborating with the Alliance for a number of years on disseminating the Arthritis Foundation's Walk with Ease program. And so it's really exciting for me to be able to share out on one of these webinars. I've listened in myself and appreciate the chance to be able to share what we've been working on. So as Serena mentioned, I'll be referencing these two logos to the side here of U-Turn and the Iowa Community Hub. And our partnership has been really central to our ability to disseminate the program, and also the local partnerships are also really important. So I'll highlight those as well. So first I'll introduce members of our broader team, and I put plural there because there's lots of teams. So our U-Turn research team includes these 5 colleagues among others, but our U-Turn team is a campus-wide network of people that care about translational research in a lot of different settings and systems. And so my work is more in physical activity and public health. And so we worked more specifically with the Walk with Ease program. So early on, we started working with in the state to try to build a framework for disseminating Walk with Ease in Iowa. And you'll hear a little bit about that journey. But the colleagues here are the ones that have been central to building that infrastructure for us to do this through U-Turn and on campus. But additional expertise and roles really comes out with all these students. So we've built a really strong student network of leaders, and the students benefit by learning how to deliver and coordinate a clinical trial and this kind of outreach. And they also enjoy interacting with our participants. So it's been a really great model. So the students change every year, but we get really excited about helping them on their journey as well. So they get a lot of the credit for the work, and especially Abby Caniglio is the project manager now, and so she leads these students, and I wanted to credit her especially for leading that effort. All right, so in terms of the flow here, I'll cover a little bit more on our U-Turn team and our approach, which emphasizes implementation science, and then I'll kind of walk through the progression and evolution of our work with the Walk with Ease program, both locally and then how that helped us spread our program across the state. And I think that's really an important part, because the approach we used in building our local Walk with Ease program now gives us that experience in building these partnerships that I'll emphasize. So clinic-community partnerships have been critical for our local program, but they also gave us insights about what's needed across the state. And so we're kind of disseminating that whole model. And that's what I'll try to cover here, is the importance of partnerships in general, but also clinic community partnerships for promoting engagement and sustainability. So first, a little bit of, again, background on our work with the Arthritis Foundation's Walk with Ease program. And I've really enjoyed the chance to work with an evidence-based program like this, and to figure out how do you take it to the people? How do you disseminate it across the state? And that's been a fun challenge, and we've made some inroads there. And so again, I'll highlight our collaboration between our U-Turn work and the Iowa Community Hub. So this is a cover page of what our U-Turn website looks like. It's one of several rotating screens, but this indicates that we are committed to facilitating the translation of evidence-based programs into practice in an array of settings and systems. And so again, Walk with Ease is an evidence-based program, and we're working towards disseminating that across the state. This is the vision of U-Turn, enabling healthy lives by empowering communities to take action informed by science. And the logic model below is what was in our original kind of campus-wide charter. But we're a transdisciplinary, or we emphasize transdisciplinary work, which by definition includes community partners. So you'll see on the left that our transdisciplinary approach kind of connects with and through community stakeholders. And collectively, we're learning from community partners, and they're learning from us. And so it's that reciprocal relationship in the middle there that really drives that science-driven practice. And eventually, we hope to build enhanced community system capacity and sustainable impact. And so again, that happens locally, but also across the state. And so over the past 3 or 4 years, our work has somewhat evolved where the Iowa Community Hub is our main partner. So we do a lot of different work in different settings, but at least for a number of us, our core work is now facilitating the dissemination of an array of programs in collaboration with the Hub. So I'll be highlighting mainly Walk with Ease, but we're trying to build that whole foundation in collaboration with the Hub and then support other community partners. So a little bit more about the Hub here. So if you're not familiar with community care hubs, this is a nice definition, and there's other resources to go, but the Iowa Community Hub is an example of a community care hub. And they're increasingly emphasized and recognized as a key strategy for improving public health and healthcare. And so it's really the integration of the clinic community that is what is unique about the Iowa Community Hub. So they do a really good job of capturing referrals from clinic partners and then referring people and services through community-based organizations in our state. And so this is the Iowa Community Hub is getting recognized as a model community care hub across the country, and we've enjoyed the chance to contribute to that effort in some ways. But I did want to emphasize that most of that credit goes to Trina Radsky-Suchan. So she's the initiator of this whole effort. So we started working with Trina probably back around that beginning era of 2017, but she's been building out this structure and framework of the Iowa Community Hub over many, many years. And it's, again, been a credit to her leadership and her skills in connecting partners. She's just great at that. Our team at U-Turn have played an increasing role over the last 3 or 4 years with the ability to provide funding. So we've started collaborating on a number of grants, and that's where those CDC grants have hit. And that's enabled us to build capacity and also the Hub to build more capacity. So that's, again, central to that partnership idea. So this is another picture of the Iowa Community Care Hub model, and it depicts kind of the role of U-Turn as one part of the overall organizational chart, because we're leading the implementation and translational research subcommittee for the Hub, among other things. Okay, so now a few points about the Arthritis Foundation's Walk with Ease program. If you're not familiar with it, I'll just give you kind of a few highlights. But it's, again, an evidence-based program, and it shows the original paper that Lee Callahan led on the evaluation of the program and its potential for addressing symptoms of arthritis. And that's the book that's part of the package in the plan. Walk with Ease is now endorsed by the CDC as a lifestyle management program. So even though it's shown to address arthritis symptoms, it is also just a good overall physical activity program for older adults and promotes independence, balance and strength, and among other things. So we've sort of built on that capacity, and now our U-Turn team is kind of leading the statewide coordination of Walk with Ease in Iowa in collaboration with the Iowa Community Hub. And this shows a picture of how the Hub kind of serves individuals as well as program providers and clinicians. So that's that triumvirate role that they play. So now a little bit more about our implementation science and what we brought to the project. So rather than just disseminating the Walk with Ease program, our interest is more about learning how it works and how to make it work better. That's really the essence of implementation science, is we want to understand that what makes it work, how do we refine it further, and then most importantly, how do we then train other people to do it? So how do we build a system that can maintain programming both locally and across the state? And that's really been our focus. So this is a picture of our website. Now, participants can go here and learn about our program. Organizations can go there and learn about how we can provide training and support. So if you want to learn more about our project, you can go to walkwitheseisu.org and you'll see more there, and some little videos and other examples. But this depicts kind of what happens at a local Walk With Ease program. And so I'll just walk you through kind of our Story County Walk With Ease, but we follow the standard group program. It's a 6-week group protocol, so participants come 3 times a week. It's individualized, self-paced, social, so you're getting a sense there of the pictures and what goes on. It's delivered in community-based locations, so rather than delivering it on campus, we go out into the community and find partnerships and locations where it's easier for people to find it, and they're getting a program. They're not necessarily signing up for research. You'll see later that we have been able to study the system, and they enroll in research through the project, but the programs are delivered in community-based locations. This just shows 3, but we're currently delivering this in 6 different locations in Story County, and have found increasing interest among senior centers and retirement homes that wanted us to bring the program into their location. So we've increasingly been doing that. We do deliver this as if we're operating as a community-based organization. So it's delivered by a licensed leader that we train, that follows the Arthritis Foundation's training model. And it's also supported by trained ISU students. So again, we train them to be part of the implementation and evaluation team, and that's been a good partnership. So as kinesiology faculty and staff, students, we're very committed to the benefits of physical activity, and this just shows a few of the benefits of walking for older adults. Obviously, most of you know these things: increased mobility, reduced fatigue and independence, arthritis pain, quality of life. But we became interested in the potential of Walk With Ease as a fall prevention program. And so this slide depicts kind of this cycle of falling that is unfortunately too common among older adults, that as they lose or decrease their physical activity, they lose function. When they lose function, they develop a greater fear of falling, and that leads them to be less active, and their function gets worse. And so we've started getting interested in Walk With Ease as a way to break that cycle and kind of change it, flip it the other direction. So if we can increase physical activity, we can improve their function and reduce their fear of falling. And so again, there's many evidence-based fall prevention programs, and there's also many arthritis-based programs, but Walk With Ease is not currently a fall prevention program, but we think it has potential, and we've been exploring that. So this is some pilot work that was led by Nick Lamoureux when he was a doctoral student here at ISU. Now Nick's at the University of Nebraska Kearney, and he's still part of our team. But he led this project evaluating the potential of Walk With Ease for fall prevention. It used, again, the standard group version of Walk With Ease delivered in a community-based setting, and we evaluated the outcomes with the STEADY protocol, this established CDC's protocol for fall prevention. So I'm going to show you a series of 3 slides that kind of hint at that potential already. So this is one that shows results for the 30-second sit-to-stand test. And again, we didn't randomize people into 2 different groups in this case, but we divided them into low and high risk for falls. And in all 3 cases, you'll see stronger effects for those that had a higher risk of falling. And so in this case, the red bar is carrying the majority of the influence here, showing that people that had high risk had bigger gains than people that had low risk. We saw the same pattern for timed up and go test, where participants that had a high risk of falling improved their time up and go performance more than people that had a low risk, and the same for gait speed. People improved their gait speed more that had high risk. And that makes sense that people have a bigger room for improvement, but the fact that everyone improves to some extent in most of these tests shows that it has that potential for as a fall prevention program. And that's what led to the first CDC project that Serena mentioned, that formally is evaluating the potential as a fall risk program. And so I'll fly through the protocol here. Nick led the protocol paper, and this is available online if anyone wants to read it. And you could also go to clinicaltrials.gov and learn more about our trial. But the novel feature of our study is that it's using a 2x2 factorial design that enables us to look at both standard versus enhanced versions of Walk With Ease, and then also behavioral conditions. So the arms of the intervention are shown here. So the standard Walk With Ease program includes this group walking for 45 minutes and then stretching and strengthening exercises for about 15 minutes each day. And so these are the standard exercises that are all very good for helping older adults. But in the trial, we're directly comparing that to balance exercises that have been prescribed by physical therapists. So this shows an example of a progression for dynamic balance, that they might start off at level 1, and then they progress to level 2 where they're making the movement more complicated, and then to level 3. And so our students train the older adults in gaining confidence in trying additional balance challenges. And that the concept or hypothesis would be that these balance specific exercises will have a bigger impact compared to the static stretching and strengthening. In terms of the behavioral conditions, we're also using the established portal that the Alliance is so good at facilitating and supporting. So this is the standard education portal, and it's already very good. But we also have tweaked that further and focused our delivery on habit formation, and we provide a health coach. So we're sort of looking at, can we amplify the effectiveness of the portal as well, and the use of the portal. And so these are the 4 conditions. Our trial's been running as planned, and we're in about 2.5 years into it now. And so we run each cohort, or each semester we run a new cohort. And so that cohort model has been really an important step for us, because we've found that we have gotten better at implementing some of the conditions and tracking them. And so we're actually evaluating our trial using cohort as a main effect. So rather than just looking at the overall outcomes, we're going to be looking at cohort-specific changes. And you'll see that kind of on one of the upcoming slides. But this shows the overall enrollment and the standard consort diagram. And again, our work is still in progress, so we won't be sharing too much about this. But it's been going as planned. We have a small number of dropouts that is about proportional to what we expected due to medical issues or other things that people withdraw from the trial or have to for medical or travel issues. But overall, the trial has been progressing as planned, and we're excited to start looking at the outcomes. We're kind of currently only looking at the overall effects, and this slide shows the changes across these four cohorts. So the green reflects our most latest cohort, cohort 4. And again, you'll see that bigger gains in the chair stand test, the timed up and go, similar tests or outcomes for the 3-minute or 3-meter walk test, and also for the step test. So again, we're getting bigger effects in the longer cohort, and we're only looking at overall effects. We're not stratifying by the conditions at this point. So overall, again, the trial's going as planned, and we hope our work could eventually contribute to Walk with Ease being a fall prevention program. And so this slide shows current evidence-based fall prevention interventions, but we hope that when our trial is completed, we can submit paperwork for Walk with Ease to be considered as a fall prevention program as well as an arthritis evidence-based intervention. So that's the progression there. But I wanted to highlight again the importance of our local fall coalition and the partnerships that have made this project a success. And so this slide shows a website that is about our Story County Falls Prevention Coalition, and we post all of our minutes publicly on this Iowa Falls Prevention Coalition. And some of the examples of success are just flashed up on the screen here. We have quarterly meetings, and that's enabled us to pull in local clinicians, the leaders of our local clinic, the hospital, the physical therapists, people in the emergency room, various other staff that work with older adults. And so that engagement's been key. We've collaborated on mainly fall screening. So the coalition has helped us get more visibility and coordinate community-based fall screening, and that's been important for us to identify people that might be a good candidate for our trial. So we're only involving people that have a documented risk of falling, and so we have to screen them and identify if they have a risk, and then hopefully refer them to the program. And the therapists and clinicians have been key in that. We also collaborate with the public health office on offering or supporting fall screening at senior health clinics throughout the county to help us reach people that can't get to their doctor. And that's been key. And the last part is that we've built referrals directly into the electronic medical record. So there's best practice alerts that clinicians can directly refer to the hub through their Epic system, and then the hub can contact them and refer them to us. So the essence of our program can really be summarized in this slide. I'll show a little schematic here of how it works, but basically we do screening and referrals from our Mary Greeley Medical Center through Epic. These referrals come directly to the Iowa Community Hub, who then refers them to us. So while we could enroll people on our own, we're testing this model to see, can we get clinicians to refer and screen and get the process to work through the hub. We then deliver Walk With Ease as a community-based organization to improve these outcomes. And then the engagement or the outcomes of whether they enrolled or completed Walk With Ease are shared back with the hub so that it can get back to the clinician where they want to know if their referrals mattered or if people finished the program. And so this has been, again, a key part of our success is getting this system in place so it has mutual benefits for everybody. Our local coalition model has been since endorsed by the Iowa Falls Prevention Coalition as kind of a model coalition, and we're working with them to build other coalitions around the state. We also have put our online or our fall screening course online, and it's now available for CME credit. So we're starting to train other clinicians and public health leaders in fall screening. And that's our training program basically trains them also in how to refer to the hub. So it's an integrated system. We're not just training them to do screening, but also how to refer to the hub and how to deliver evidence-based programs. And so we're kind of continuing that effort. This is a flyer that we're currently using to promote the fall screening course. And again, it's based on STEADY, but it's operationalized as part of our FRAIL team that we're delivering fall risk and adult intervention linkages. So we're linking them to interventions. I'll keep moving here. So our community-based model and our engagement with the hub were key to helping us secure the second CDC grant. And so this is one that's focused on arthritis. And I wanted to highlight that we're one of 12 states that are funded through this program. We're a component A state and in yellow, and the others are component B states, but we're one of only 2 states that are not funded through a health department. And that's somewhat novel because in this case, our partnership with the hub and our evidence of this community linkage enabled us in Iowa to secure funding as a state coordinator of arthritis care. And our model is being recognized as a good example of that. So we have additional advantages over delivering this through a health department because we already know how to disseminate the program. And so this is another depiction of our integrated model. So again, in this case, you're going to see healthcare on the left and community-based organizations on the right, but we're trying to train healthcare systems to refer into the hub for arthritis care. The hub would then refer them to community-based organizations, and I'm highlighting Walk With Ease, but we also train in Tai Chi and Better Choices, Better Health, and other evidence-based programs. The CBOs then refer back to the hub, again, with the same idea and share information back with the healthcare system. So it's the same bidirectional feedback that we developed before, but and locally that is now being implemented across the state. So our project is kind of guided by this interaction system framework. So we're a translational system. The hub is a support system, but we've also partnered actively with our extension team here at Iowa State, and they're our primary delivery system. And this triumvirate has been really helpful because now we have a way to get the word out into the counties across the state. And it includes support from all 3 systems. I wanted to walk through one more model. You see I'm using a lot of these little pictures, but this is our model for this project. And you'll see it still has elements of, on the left side, clinical partners. So referral sources and connector partners are kind of drawing attention into the hub. And on the right-hand side is the delivery organizations, the area agencies on aging, YMCA, and extension. And they're the coordinating groups that are delivering the interventions. And we also have teams that are coordinating these 3 different intervention types. And so collectively, I'll walk you through how this logic model works, but we kind of empower each team to kind of have their own goals of how they're going to accomplish and help us move forward as a state. But this depicts our logic model. So the delivery organizations and the ABBY coordination teams are collectively working towards the overall goal of increased availability and accessibility of these ABBYs, with Walk With Ease being one of them. And so we need to get more of these programs available. So that's kind of the supply side. Then we're also working with the connector partners and the clinicians and the referral sources on the demand side. So there we're trying to get increased referrals of these to ABBYs. So we need more clinicians to be aware of the hub, more of them to be aware of how to refer patients, and they also need to know that these programs work. And so that's where the translational research comes in. They want to be convinced that there's evidence-based programs available. So collectively, if we get more programs and more referrals, we can get increased enrollment resulting from these sustainable strategies. And then collectively, the screening and referrals will also increase the number who get counseling. That's another key goal of these state grants. And collectively, that will decrease disparities with arthritis in Iowa. So the model's been working well for us, and we hope we can continue our work. We're sort of in limbo with our CDC funding, not sure what the future will hold, but we're hoping we can continue with some of this. And I guess the advantage of community partnerships in this case is that some of this is sustainable just because we've built it that way with community partnerships. So we hope that we'll continue this regardless. All right, in the next minute or so, I was just going to fly through our approach of how we've built capacity through the state to draw interest in Walk with Ease. This is a landscape assessment that we've done, and maybe I can have Serena send this result out, but we captured the whole state and found out what is the interest of Walk with Ease and availability across the state. And these are responses that came in from across the state. Let me just fly through some examples here. This is where Walk with Ease was reported to be available in Iowa, but then we actually captured interest. So across the state, we had more interest in Walk with Ease, as well as Tai Chi, as well as Better Choices, Better Health. And so we had a lot of interest. So our task then is to figure out how do we address that interest. So we've built a training model where counties can opt in to training and support. We guide them through completing the Arthritis Foundation's leader training. Then we provide supplemental training on how to really do this. How do you really deliver it locally? And we've been evaluating that with REAIM, which many of you might be familiar with, as an example of how do you study the adoption, implementation, and maintenance of programs. And this is where we're at. So we're sort of taking this interest in Walk with These leaders, guiding them to complete the Walk with These training, and that's where adoption is tracked. Then we hope that after they adopt, that they implement. And so then we're tracking the number that are implementing and delivering Walk with These in their counties. And you'll see bigger dots in Story County there, where our team has kind of led the way, but we're getting traction from other counties that are also now delivering Walk with These. And ultimately, we're trying to track this as reach into all across the state. So again, our Story County dot is in the middle and shows that we're tracking that, but we're hoping to spread that reach across the whole state. So I'll stop there, and I'm happy to answer any questions. Thanks, and sorry for going a little bit long.
No problem, Greg. Thank you so much. I appreciate it. We do have a little bit of time for some Q&A, and I already have one in the chat. So if you have a question for our speaker, please feel free to type it in the chat and we will read it aloud. So the first question came in, how do you promote Walk with Ease to the more rural residents of Iowa?
Yeah, I think that's where our delivery team is kind of working to spread that reach across the state through extension and through other partnerships. So, making people aware that the program is available and that they could sign up for this training. And we also work closely with area agencies on aging, and they have an interest in delivering evidence-based programs and can then track Walk with Ease as one of those programs and get the hub to support that effort.
Mm-hmm. Awesome. Great. And another question just came in. Are you using the 3-item or the 12-item study screening?
We use the 12-item, but the 3 items are obviously weighted higher that have a stronger prediction with fall risk. So in the clinical setting, the physicians do use more of a 3-item version, but in our work, we use the full 12.
Mm-hmm. Great. And in that first project you were talking about with the fall risk screening, how does fall risk screening fit with your long-term plans to promote Walk with Ease in Iowa?
Yeah, thanks for that question. One of our visions or the things we've learned is that fall risk is obviously of great importance to many, many people. Arthritis is as well, but I think fall risk is a more tangible experience for people. For older adults, they have a fear of falling because they've heard of friends falling and they're worried about it. And also clinicians are obviously trying to track that. So we view it's like a stronger trigger to get older adults to maybe sign up for screening and to get them referred into programs, but it's also more salient for clinicians and people in the ER than maybe arthritis may be. So
Yes.
increasingly, we see that both of those programs kind of go hand in hand. And I think that's a trend you're seeing everywhere, that many of these arthritis evidence-based interventions are also fall risk prevention programs.
Absolutely. Right. Oh, I look forward to learning more as your study progresses. I think I'm right there with you, wanting Walk with Ease to be recognized as a fall prevention program. Um, I'm going to go ahead and cut the questions there since we're a little bit over time, but I want to thank you again, Dr. Welk. I really appreciate your insights and just want to remind everyone that we will be sending out the recording to this presentation and some supplemental materials that Dr. Welk has provided with us. So I think that will provide you with a little bit more information about that landscape survey that he just briefly touched on at the end. In just a minute, we're going to launch a brief satisfaction poll. So please just take a minute to answer those questions before you leave our webinar today. And we would also invite you to join us on April 30th for an extra edition of our Lunch and Learn that will help us kick off our Arthritis Awareness Month campaign. The April 30th presentation is titled Digital Delivery of Osteoarthritis Lifestyle Care, and it's going to feature Dr. Belinda Lawford. And I will go ahead and put the link for that in the chat as well so that you can register for that immediately. Thank you again to everyone for being here, and have a great rest of your day and rest of your week.